Health is one of those essential areas that has to be safeguarded as essential to public services. If health provision becomes a service and a function of the marketplace and driven by profit, then people without means will suffer. People who are poor will suffer if that happens. A decent public health service is a vital component of a civilised society. It's a public responsibility of all of us to work together to provide access to healthcare for everybody, from the womb to the tomb. If anybody has to suffer a long-term illness without treatment, or die because they can't afford early intervention or ongoing healthcare, then we all fail. It isn't just Mary Harney fails. It isn't just the hospital system fails. We all fail together as a society. Labour and Fine Gael have produced a comprehensive costed health policy that will transform the health service and give equal access to all. Among its provisions are an additional 2,300 hospital beds, scrapping the Harney plan to build private hospitals on public land, extend the medical care coverage to 40% of the population over the lifetime of the government, extend GP-only cards to all children under 5, and those of us who have to take children to a GP will know how much that will mean, introduce free health insurance for all children up to the age of 16, employ 1,500 new consultants, at least 1,500 additional convalescence and rehabilitation long-stay community beds, the expansion of community support services for the elderly to live independent lives as far as is practicable. And could I say this? I was, part of my freelance work, I was involved in developing a daycare centre in Ballymahon in County Offaly. And part of it I had to work with older people who come to the daycare centre so that they can spend as long as possible in their own homes. And it's a marvellous community service that is funded by the HSE and under the Transport RTI. In one of the focus groups, this woman said, "Do you know what?" She said, "It is great to be old. I've never been as happy in my life as I am now, and it's marvellous." And we can create the conditions where people will say those things. And finally, an increase in the number of home help hours. At a local level, we need significant investment in the A&E here in Portlaoise Hospital. We have a growing population. The population of this county has gone up by 14% since 2002. In fact, Portlaoise has gone up by 55% since 2002. We are at the junction of major national routes, the N and M7, and N and will be M8, and we're on the path of mainline trains. So we need to be in a position, as well as with our local population, to handle major national emergencies. However we look at it, nationally or locally, health has to remain a public service. It has to be ours together, and it cannot be left to be picked apart by the practitioners of profit. It has to be ours.